The nose occupies a central position on the face. So how a face looks like depends on a great extent to how the nose looks like. So whenever we are planning a rhinoplasty in a patient, we have to ensure that the nose looks harmonious with the rest of the facial features. Here comes in the role of preserving ethnicity in rhinoplasty. Hi, I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Cosmetic Clinic, Saket. Today, we're going to be talking about how rhinoplasty differs among various ethnic populations and how we have to respect it while planning a rhinoplasty. Rhinoplasty या nose job एक बहुत ही पॉपुलर प्लास्टिक सर्जरी प्रोसीजर है एंड हमारे पास काफ़ी सारे कंट्रीज से काफ़ी सारे स्टेट से पेशेंट्स आते हैं ये प्रोसीजर कराने के लिए. एंड व्हेन वी आर प्लानिंग अ राइनोप्लास्टी इन सच पेशेंट्स वी हैव टू अंडरस्टैंड कि जो नोज़ हमने बनानी है वो बाकी फेशियल फीचर्स के साथ मैच करनी चाहिए. सो कुछ बहुत स्पेसिफिक पॉपुलेशंस हैं, स्पेसिफिक कंट्रीज़ हैं जहाँ की जो नेज़ल फीचर्स है बहुत यूनिक होते हैं. जैसे अगर हम बात करें अफ्रीकन्स की तो उनकी नाक थोड़ी सी चौड़ी रहती है, उनका जो नेज़ल ब्रिज या डॉसम है बैठा हुआ रहता है एंड दे ऑल्सो हैव अ वेरी थिक टिप. सो we have to plan rhinoplasties a little differently when we're talking about Africans vis-a-vis when we're talking about, say, rhinoplasty in a Caucasian patient or a patient from the Middle East. Now, for example, if you're planning a rhinoplasty in a African patient, then we have to understand that uski main concerns kya rahengi. The person is going to be concerned about the depressed dorsum, the broad ala, flared nostrils, and also will want the height of the nose to be increased. Now, vis-a-vis when you're talking about a patient from the Middle East, usually इनमें क्या होता है कि they have a hump over the nose, the nasal dorsum might be too high, and also they might have cartilages which are flared, tip जो है वो bulbous होगी और वो चाहेंगे कि उनका जो nasal height है उसे हम थोड़ा सा कम कर दें, थोड़ा सा और face के साथ मैच करा दें. थर्डली कम्स अ पॉपुलेशन जैसे हमारे ओरिएंटल रेसेस हैं या इंडिया में भी नॉर्थ ईस्टर्न स्टेट्स के पेशेंट्स हैं जिनमें जो कंसर्न्स है वो होती हैं कि हमारा नाक जो है बहुत फ्लैट लगता है या हमारी नॉस्ट्रल्स जो हैं बहुत वाइड लगती हैं. सो ये एक अलग सबसेट है जहाँ पे हमने बेसिकली जो नेज़ल ब्रिज है उसे उठाना रहता है. अगर नॉस्ट्रल्स बहुत वाइड हैं तो उन्हें छोटा करना रहता है. बट जब भी हम इन तीन अलग सबसेट्स में राइनोप्लास्टी प्लान करते हैं हमें ये याद रखना है कि हमें drastic changes नहीं बनाने हैं. We have to make the nose match the rest of the facial features. So today I'll be just touching upon each subset and what we plan when we're planning a rhinoplasty in a patient belonging to these populations. So let's talk about a group which has a very strong nasal structure. I'm talking about the Middle Eastern patients. अब इन patients में the cartilages are very strong. इनकी सबसे common concern एक hump होती है, हो सकता है नाक में deviation हो, and the cartilages जो हैं वो बहुत strong होते हैं लेकिन tip definition बहुत patients में lacking होती है. So they have a good cartilage structure but the tip is bulbous, it is wide simply because the cartilages are not really in the alignment they have to be. So when we are planning rhinoplasty in such patients, basic aims are to narrow the dorsum down, to correct the hump if it is there, to correct any kind of nasal deviations, and to use, say, suturing techniques to bring the cartilages together. So we have a well-shaped dorsum, we have a fine tip. Some things we have to take care are not to lower the dorsum too much. We can't flatten their noses too much because then that doesn't look harmonious with the rest of the facial structure, which is usually again very contoured of face. And also to preserve the height of the nose. So these group of patients usually request कि जो आपकी जो नेज़ल ब्रिज की हाइट है स्पेशली बिटवीन द आइज़ उसको बहुत ज़्यादा लोअर ना किया जाए बिकॉज इन देशों के जो पेशेंट्स होते हैं उनकी नाक लंबी रहती है. तो अगर हम डॉसम को बहुत ज़्यादा लोअर कर देंगे तो इट विल गिव द अपीयरेंस ऑफ अ शॉर्ट नोज विच इज़ नॉट कंसिडर्ड ब्यूटिफुल इन दिस एथनिक ग्रुप. नाउ लेट्स कम ऑन टू द ओरिएंटल रेसेस. Oriental races usually have a nose which is flattened. So the main aim of rhinoplasty in such patients is to elevate the dorsum. Also, they have a weak cartilaginous support structure. So we have to augment that, and in such patients we have to counsel the patient regarding, say, the use of costal cartilage जिसमें हम rib का एक portion लेके नाक का dorsum create करते हैं. Again, इनमें हमें ख्याल रखना है कि nose को बहुत ज़्यादा पतला ना किया जाए, टिप को बहुत ज़्यादा पिंच ना किया जाए क्योंकि यूजुअली इनके जो चेहरे हैं वो ब्रॉड रहते हैं एंड अ वेरी small sharp nose will not look harmonious. In fact, it will actually look like a badly done nose job. The third group which requires a rhinoplasty most often is Africans. These people have thick skin and usually a depressed nasal bridge and a wide tip. So in these patients, again, the aim is to build up the nasal bridge, give it a sharper, defined look, and also to narrow the nostrils. Again, even in these patients, the facial structure is usually wide, and so we have to ensure that we are not creating a very pinched nose. Also, the patient has to understand that there will be limitations in the kind of tip we can create due to the thickness of the skin, and that also has to be clearly explained to our patients during a rhinoplasty consult. The ultimate aim of a well done rhinoplasty is to create a nose which looks beautiful but is still in balance and is merged well with the rest of the facial features. If you have any further queries regarding ethnic rhinoplasty and differences in techniques catering to various populations, please feel free to reach out to us at the numbers given below.